Hi everyone, it's Manda here and the baby from Palmer Health, and today we're going to talk about wound care. How do you dress a wound properly, like a nurse? So because we don't have the full medical kit that we'd have in hospitals or the workplace, I'm going to show you a few essentials that I recommend you buy for your home. I love having a dressing tray, but today we're out in the wilderness. So I've made it out of a piece of printer paper with some cling film around the outside. Cling film is one of the cleanest things in the world. Glad wrap. When it's shrunk onto the rolly thing, it's free of bacteria and microbes. So it's a great little workspace. Make sure you don't touch it too much. And we're going to open everything out and start from the left, which will be our clean side, and work towards the right, which will be our dirty side, and then throw the waste in the bin. So I've got some tweezers that I boiled in hot water on the stove for 10 minutes, and then I wiped them with alcohol. And I've got some bits of gauze here, and they've been soaked in saline solution, so I'll just wet them a bit more. If you had a sterile bowl, I'll put it in that, but I wouldn't just sit them in any bowl because the germs might contaminate them. I've got some more gauze to cover the wound after, and a plaster and a bandage as well. So what we're going to do is always start from the left-hand side and pick up the cotton wool, the gauze. Actually, try and use gauze instead of cotton wool because cotton wool will leave fibres in the wound. First, I'm actually going to put my gloves on. So glove up, because you're actually doing it more for the patient's safety and infection than your own at this stage. So even if it's your own child, do try and put some gloves on, because if you do accidentally touch their wound, it'll be better. And you've even got the choice to just do it with your hands if you're using sterile gloves. I prefer to use the tweezers or the forceps. Now we've got two ways of cleaning the wound. In round wounds, we believe in medicine that the middle of the wound is cleaner than the outside. So we start in the middle and go in small circles around the outside. Once we get to the outside, we dispose of it in the bin. The other thing we say is that the top of the body is cleaner than the bottom of the body. So if it's a long wound, we can go from the top of the wound down and then dispose of it. Try not to cross-contaminate. Try not to move your dirty things back over and throw it over there, because little microbes might fall down into the clean dressings. So one more time, take it in, around, outside and down, and then that's done. I use saline because I think it's wonderful. It's one of the cleanest things in the world, and it's great for wounds. The latest research shows we can actually just as successfully use warm soapy water if it's clean and not contaminated. However, a lot of people seem to think we need to use betadine or chlorhexidine or one of those chemicals. However, they can actually slow the body's healing down. We only use those things on wounds when they're really contaminated with foreign bodies. Most of the time, saline or soapy water will be adequate, as long as it's clean soapy water. You know, if it's coming from shampoo or something at the top of the body, by the time it got to the bottom of the body, it would contaminate it. So I've cleaned that, it's dried a little bit. Now I'm going to take my gauze and just lay it over the wound like this. And then I'm going to take the sticky stuff and put it on the top. And pop it on like that. Now I'm going to leave the wound in the dressing, hopefully for about 2 days, unless I see ooze coming through and it really looks mucky and it looks like it needs a clean. Keep it dry, try and leave it for 2 days, and then when it's time to take the dressing down, what we're going to do is rinse it off. So we just pick up the corner here and wet and wet and wet it. And then we're going to lift up the corner here and just rinse it off. Rinse, 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 rinse. And we're going to basically soak it off, so we're not ripping all that body's good healing work off when we rip off the Band-Aid, so to speak. So make sure you soak the dressing off and peel it off really, really, really gently. Repeat the process. And most wounds should take, 7 to 10 days to heal, replacing the bandage every 2 or 3 days, unless it's dry and sloughy and needs changing every day. Next episode, I'll talk about the different products we have and the rationale behind each product we use. Thanks for listening. I hope it helps. Stay safe, stay hydrated, and keep your wounds clean.